And we have Dr. Louis Chan, who is actually an expert in fertility. So we're going to go from the topic of IV drip therapy to IVF in that matter. Now, I know that this opinion of mine might be against the statistics that was provided by the government. Now, there's been stats showing that last year, for instance, in Hong Kong, we had such a low birth rate. It's the 7th consecutive year of a decreasing birth rate here in Hong Kong. And we even hit a record low since the statistics were even started 56 years ago. But I feel like I have so many friends around me making COVID babies. So I want to ask, from your point of view, from your clinic's observation, for example, are people wanting to start a family during the pandemic?
I do see a lot of couples trying to start a family, to have a baby during the pandemic.
Right.
But the issue is more difficult for a lot of couples to have a baby now for 2 reasons, basically. The first one is male sperm quality and quantity been dropping quite significantly in the last couple of decades.
Is that so?
That's
Is there
right.
reasons to that?
Most likely it's because of a change in the living habit.
Okay.
For example, you lack of exercise, you don't eat very healthily, and a lot of stress, and a lot of unhealthy habits such as smoking or a lot of alcohol that will make the sperm less good.
Okay.
Fortunately, for the man's sperm, is actually you can try some ways to improve the quality and quantity of the sperm.
How?
The first way is to live healthier.
Okay.
So avoid some cholesterol, exercise a bit more, quit smoking if you do smoke.
The basics?
Yeah, the basics. The second one, which is contrary to a lot of people's belief, is to clear your semen more frequently.
Oh.
Yeah. You know, I see a lot of men, they have a concept that I store
Right.
my
They save their
semen.
ammo.
Yeah, save them. And then, okay, we predicted Wednesday night will be the night that my wife ovulate.
Right.
So we store that for that one evening.
And just wait it out.
And that's a wrong concept.
Really?
Yeah, because after the production of the sperm, they actually keep being damaged by the oxygen radicals in the environment.
Right.
So if you store them longer, the quality actually drops.
Oh.
So our advice to men is to clear your sperm three times or 2 times a week or every 3 days.
Okay.
Yeah.
So that's a healthy cycle.
Yes.
Right.
The third way is there are some pills. The first one I mentioned in the first part is some micronutrients.
Okay.
There are some supplements that can improve the sperm. And you can actually take a medication to improve the sperm as well. Then you need to see your doctor for it.
Sure.
But on the other hand, for female, it's very difficult to improve the quantity or the quality of the eggs, unfortunately. The reason for that is men keep producing their sperm
Yes.
every 73 days.
Right.
If you have lived healthier and you have taken something good for your sperm, the new batch will be better.
Right.
However, women are born with a certain number of eggs. And when all the eggs finish, that's called menopause.
Right.
So it's inevitable that the quality and the quantity of the eggs will drop with age. And it's very difficult to reverse.
That sounds so not fair biologically.
Well, nothing is.
That is so true. So what to do if, let's say, we found issues, or if we want to start a family, we go from, the couples, they both have to come see a doctor and see how they can increase their chances of having a child, for example. What would be the first thing that you look into before giving them advice?
I think the first I will look into is, first of all, do a semen analysis. It's very simple. You put the sperm under the microscope. You look at the number and how many of them are moving.
Right.
And then for the female, you do a scan, look at the uterus and ovaries, make sure their reproductive organs are normal.
Okay.
And take a blood test to see how good or how bad their ovaries are. That will be the initial assessment.
Okay.
And then if the initial assessment are good, they can go to try a couple of months.
Okay.
If no luck...
Just naturally.
Yeah, naturally. No luck, then come back.
Okay.
And we'll do more tests.
Right. And then maybe provide other alternative methods.
That's right.
You mentioned the sperm analyst. You've got actually a couple of videos for us to understand what it really is for good sperm and poor sperm. Shall we take a look at them?
Yes, please.
All right, let's see.
See, in this picture, you can see a normal sperm.
Okay.
A good number.
Yep, pretty
and
active.
They're moving very actively.
Yes.
So this is a good sperm.
Okay.
And let's look at the second one.
All right, let's take a look at the second video.
The second one, yeah, you will see less number
Okay.
And a lot of the sperm are not moving.
Oh, that's significantly
Yes.
more
You
inactive.
see, maybe only 1 in 10 or even 1 in 20 are moving actively.
Right.
Yeah, a lot of them are, they're staying on the slide. They're not moving at all.
Yeah.
Yeah, some of them actually have an abnormal shape. Some of them don't have a head.
Right.
Some of them, the tails are being bent. So these are not normal sperm.
Understood. Is there still a chance if the sperm analyst comes out like this?
It depends on how bad.
Okay.
So you have normal here. You have people, they are here, they've just failed.
Yep.
But there are some methods like ejaculate more frequently, some pills you can improve it.
Right.
There are people down here. If there are people that are really insufficient sperm number or they're not moving, the only way to help them might be test tube baby.
Ah, I see.
That might be the only way out.
Right. How is test tube baby different from IVF process?
Oh, IVF is test tube baby.
Okay.
So basically, in a natural conception, the natural pregnancy, men will ejaculate the sperm in the vagina, and the sperm will swim up through the uterus to the tubes, and then to find the egg.
Right.
So the egg come out from the other side, they meet up, and then they will fertilize in the embryo, and then the embryo will go back to the uterus and implant.
Right.
So that's a normal pregnancy. In the IVF or test tube baby, what we do is when the eggs are mature, we use a needle to take out the egg. So we aspirate the follicle. The follicle is kind of a bubble for the egg.
Right.
So the eggs are sitting right in front of you. So you can see them under the microscope. And then we then look at the sperm. If the sperm are good enough, we can try to let the sperm swim inside the egg.
Right.
But if the sperm are too bad, we use a needle to stuck the sperm inside the egg. To help them to fertilize.
Okay.
So when they fertilize, they become an embryo. So 1 cell, 2 cell, 4 cell, 8 cell, they become an embryo. We will find a nice fine day to put it back into uterus. And hopefully they will implant.
What is the success rate on average for IVF?
It really depends on the quality of the sperm and the age of the woman.
Right.
Let's say you make a good quality embryo, and let's say the woman is under the age of 35. The per embryo, per 1 embryo success rate, you're probably talking about 45, 50%.
Okay.
But in an IVF process, we usually trying to make as many embryos as possible.
Right. How many are we thinking about?
Well, in the best case scenario, you might have 10 or even more than 10.
Right.
But if you have 10 embryo, let's say I've transferred 1, and oh, congratulations, you're pregnant. What happened to the other 9?
Yeah.
They go to the frozen tank. And then maybe 2 years later, you come back and say, Dr. Chen, I want a second baby. Then you can defreeze the embryo and put back.
I see.
So if you do 1 time, it might be enough embryos for you to have 2 or even 3 babies.
Wow.
Yeah. Unfortunately, people usually see one part of the reason of subfertility is because of the age of the woman. So when you actually get older, let's say you are 40 or even above 40, the per embryo success rate will drop significantly. Let's say if you go to 40 years old, 1 embryo success rate, you even good quality under the microscope, you may be talking about a chance of like 25%, half of it. Yeah.
Okay.
So in this case, if you want to increase the success rate, one option is to put more than 1 embryo. You put 2. Now, the downside is
you could end up with twins.
Yes.
Yes.
And twins is a good news for somebody. It might be a bad news for somebody.
Yes. Not everybody's prepared to have more than 1 child at a time.
And how we can improve a single embryo success rate, one technique you can use is to actually test the gene of the embryo. Because why when women get above 40, their per embryo success rate is lower, is because actually inside the embryo, the genes are abnormal.
Right.
So if you want to test the embryo, you can actually stuck a needle inside and take a tiny bit of cell, only a few cells, and look at the genetic makeup of the embryo. If this embryo is normal, your chance will jump to like 60, 70, 80%.
Wow, that's significant.
Yes.
Thank you so much, Dr. Chan, for letting us know more about IVF today and also to comment on IV therapy. I want to just say a big thank you to also Jonathan Seah for letting us come to your center and take a look at what it really is all about. So now we have more clarity for those who've been wondering what it is or been curious about it. Once again, thank you so much for joining us on All Being Well. I'm Alison Howe. Do join us again next week, and Ben Cullen should be back with us by then. Enjoy the rest of your weekend, Hong Kong. Bye.